So do you guys know what this means? That's kind of like applause. So applause, I can't see it when you're clapping your hands down. So when you have it up high, that just means applause. So it's very clear and I can visually see it. I can't hear applause, but I can see it when we do that. I have a question for all of you. Does anybody know American Sign Language? Anyone here have knowledge? One, yes. Anyone else? Really? Nobody else knows sign language? So maybe one person in the back says a little bit. Okay, a little bit. I'm going to give you a test here. I bet you guys know. Oh, okay, baby signs. Yes. Cha. I bet you'll know. I bet. I bet that you guys are going to know these signs. Okay, ready? All right, I'm going to give you a demonstration here. Oh, see, you guys do know. More? No, who? Eat. Yeah. Okay. Uh, what about this? Oh, see, you guys lied. You do know sign language. What about this? Maybe. Yep. See, you guys know. And here you are all saying nobody knows any. It's in there, but it's all in there. We use a lot of different gestures, and all of that is sign language. It's in you. Most people already know, but you don't even realize that you're using it. So, um, a lot of deaf people have to be really skilled with code switching, which is this sign right here, and being able to kind of accommodate for different skill levels. That's a skill that we use every day, of being able to accommodate for your knowledge of our language. So accommodation, you can see this sign right here, and just matching where you are. But rather than it being a one way, it should be bi-directional, matching each other. Okay. So when I was asked to come here to have a discussion about language justice, this is a sign for justice or fair um, so I thought about that and I wanted to compare language access because there's a big difference between language justice, like my rights, it's my language, I'm allowed to use my language, these are my rights, versus language access, which is just trying to get around barriers. And language justice is breaking down those barriers. So I thought it was interesting when I was doing my research about those two different topics, and they mean different things. Okay, so an introduction here. My nickname is Dino. So out in the community, everybody knows me as Dino. My formal name is James Christianson. I was born as a hearing person. And then when I was 2, I lost my hearing. I got meningitis and I had a high fever, which meant that I lost my hearing. My mom freaked out. She didn't know how to communicate. Of course, a lot of parents, when they find out their child is deaf, what are we going to do? We found an audiologist. And, this is back in the 80s. Medication was very different back then. So, we're looking everywhere for help, trying to find out what we need to do. And so we finally went to this place, and my mom, or sorry, the mother in this place was deaf and her daughter was deaf, the baby was deaf, and they were signing with each other. And my mom went up and was trying to connect with them and she said, "Oh, you're signing." And so then they became a really big support person and helped guide my mom into taking classes and finding different programs. And so it was great because this person was able to help my mom kind of navigate all those challenges, getting me into speech therapy, physical therapy, whatever, finding the top school for myself and really having access. And so I still actually am in contact with that baby. That baby and I are still really great friends. So I grew up in a mainstreamed high-end school. As a public school, I didn't have an interpreter. There was no interpreter services. Okay, so just to let you know, on my side of the family, my mom's side, they speak Spanish. They're from Chihuahua. Chihuahua. Yeah. So that's the side for Chihuahua. And so that's where they grew up. And so communication was easy because we used a lot of gestural communication, and it was really nice. And when I went to school, um, there were lots of people in the class, and so they would kind of help and interpret for me. I'm like, okay, okay. And so the teacher would be speaking, and my mom finally found the right school to put me in, and I actually did much better in the other school who provided more access. I went to Rochester, New York. They have a RIT, Rochester Institute of Technology, and they have a design school there. I went to school there, and they have a deaf college there, RIT. And then I came back here and I found that there were a lot of language barriers. And I worked at the Deaf Services Center in San Diego for a while in California, and I became an advocate. And I know a lot of you here are advocates, really just making sure, fighting for what is needed. And then I moved here and I was an advocate here until just recently in July. The business that I was working for, they had to lay off workers. And so I switched jobs. But I feel like once you're an advocate, you're always an advocate, right? So I switched and I was wondering, what am I going to be doing? So I am now studying to become a deaf interpreter. Anybody know what that is? So my goal is to eventually become certified as a deaf interpreter. So I know that we're running short on time, so we'll go to the next slide. This is just a brief kind of history of American Sign Language. And you can see that back in the 1700s, um, the Spanish monk was going around and going to different houses, and he was interacting. There were two young girls, and they were gesturing, kind of using some type of sign language. And he was asking, what are they doing? Why are they doing that? And they explained that they're deaf. And so he actually set up kind of a school, an establishment for children who were deaf, because prior to that, they had no central location for that. So they set that up where they were able to teach some of those sign languages. And then around the 1800s, they had a first actual institution in the world in Paris. And they set up the language access there. And here in America, there was in Connecticut, in Hartford, Connecticut, they set up the very first school for the deaf there. And once they set that up, it was named Thomas Gallaudet as a person who set up this school. And they were doing research about how they could teach it. So they actually went over to France, and he saw that the language barriers, and like in England, the sign language wasn't as established, whereas in France they had this established sign language. And so they actually brought somebody from there over here to America and became the first deaf teacher and clerk. Laurent Clerk is his name, and that's his side name. So he was the first person to teach French Sign Language. So it's actually really similar. American Sign Language is now still very similar to French Sign Language, whereas the British Sign Language is very different. But if I meet a deaf person from France, I can kind of understand what they're saying. It's actually quite interesting. Let's stay on this slide for just a second here. So in the 1980s in Milan, Italy, they had a world conference where audiologists and different specialists came to this and said that they were banning sign language all over the world. They're saying, no, we're not going to do this anymore. And here in America, we set up the National Association for the Deaf. And we wanted to fight to protect that right to have sign language. And as I was saying, the equal access and justice. And we set that up. Even to this day, we still have the NAD. And I was involved on the board. And this is a picture of the board that I was involved in for that. And so, like I said, still to this day, that organization is still running. So ASL is a recognized language as of the 1960s at Gallaudet University and, college and university. So Stokes. The doctor there was hearing, and he said that we needed to focus on language and not sign language. And then he saw all these signings and he says, what is that? And he kind of compared it all. And then he found that there really is a language. They actually have grammar. They actually have rules, and they have an alphabetical system. And so he finally recognized this sign language as an actual language. So you can actually look up history if you want to Google it, the language and the history of sign language. So ASL became recognized as the third most used language in the United States. The first, of course, is English, second is Spanish, and third is American Sign Language. It's really taken off, and there's a lot more classes being offered in high schools. And so American Sign Language is the most used here. And I think it's because movies and media, people are seeing sign language and they're becoming more curious about learning it. So like when you go to different coffee places, if you know sign language, before there nobody really knew sign language, and now I go for coffee and I see people saying thank you and hello and how are you, and I can see that as the generations learn more and more, I see it out in the community more often. So again, I know that we're kind of strapped for time here, but ASL is my primary first language. English is my second. I had to study and learn English, of course, for communication, written communication, internet, email, all of that. And as I said, there's different rules and grammatical structures. So I identify myself as deaf, and I am a proud deaf person. I am proud of that identity. And some people prefer hard of hearing, and some people have hearing loss. We tend to not like the word loss. And I know that a lot of people don't understand, as well as hearing impaired. We tend to think of that as more negative as well. It's a medical view. And I'm like, no, I'm not hearing impaired. It seems to make me feel like I'm broken in some way. But if you say that I'm deaf, then that's my identity and that's what I accept. It's a cultural identity because there's different behaviors and tendencies. For example, to get somebody's attention, we'll, use the flashing lights, we'll tap on a table. And just as I said, for applause, this is our sign for applause because it's more visually acceptable. And at my house, my daughter, I had two hearing daughters. And we all sign, both of them sign, and that's our main communication at home is sign language. And it's really great. We have the light system, and again, getting each other's attention. And so I have you can touch people on the shoulder to get people's attention, but a lot of hearing people might feel like that's weird, but we're used to touching each other on the shoulder and just to get the attention. So it's a cultural thing. We have a dog who's hearing, and also he knows how I'm calling him when it's time for bed. If he's barking, I hit the table and he knows to come, or if he's coming, he'll get my attention by using his paw to get my attention because he knows that I'm deaf and barking doesn't do anything. Yeah, so there's also different clubs and organizations and different events that are set up for the deaf community, and it's great to take advantage of those. I was the president of Northwest Community Services for the Deaf, and so we're always trying to come up with different ideas, different communication, getting out news and discussions, and again, just encouraging events. We are here in the deaf community, we have, we want to advocate for our rights, and there's bills and legislations that come up. Right now, there are three. One is related to open captions on movies and theaters. Another one is, as you talked about, the lack of interpreting services, a shortage of interpreters, and what's going on, why there aren't enough interpreters. And so that's something that you guys were talking about earlier today. And then there's another bill that we're all really trying to advocate and fight for these bills to be passed. Yeah, next slide. So talking about interpreters, who do you think the interpreters are for? When you hire an interpreter, are you hiring that interpreter for me, or are you hiring them for you? Whoever. Right, exactly. It goes both ways. The interpreter is there for everybody in the room. The interpreter is not there just for one person. They're there to facilitate communication. So if I was just signing, you would have no idea what I was saying, which is why having an interpreter provides access both ways. It's interesting. So there is a certain difference between a certified interpreter. I don't know about spoken languages, Spanish and whatnot, but there is the Americans with Disabilities Act, the ADA, um, that actually has a section in it that requires certified interpreters. It requires a certification, but not in, actually, I'm sorry, let me correct that. They don't require certified, they require qualified interpreters. So, for example, in Montana, which is pretty far out in the country, you can't always find a certified interpreter. You might have to fly somebody in for an appointment. I mean, would you want to do that for a 15-minute appointment? A lot of people think, I'm not going to do that. I'm going to find a qualified interpreter in our area rather than getting a certified interpreter. But it's interesting because the certification isn't required by ADA. It's just qualification is required by ADA. So to get certified, you'll see interpreters tend to wear dark clothes, and they have a code of ethics that they must follow. Um, so interpreters, and again, certified interpreters, there's different things about confidentiality. Um, Educational interpreters are different. So education interpreters tend to figure out how to work in schools, and they say like sometimes they can become an assistant in communication, making sure that they're understanding the information, and they have rules, of course, included, and there's boundary issues that are included with that, but it's separate and different from working in the community. So a lot of people will be like, "Oh, I'm an education interpreter," but that's different, and again, different in the way that they behave, having children as your client versus having adults as clients. So signers. So, for example, to me, that kind of means maybe you have parents in the room and they say, "Oh, would you mind signing for your parents?" So you might know sign language, and maybe you bring your kid in to interpret for you. I really would not recommend that. It's, confidential information. It can be private information. Um, or, for example, if you're in a medical office and there's a person on staff there's like, "Oh, you know sign language, just come on in and interpret for me." But there's a big difference between somebody who knows some sign language versus somebody who is actually an interpreter, because communication is a lot more fluid and easy with a qualified interpreter. Um, Another situation. Oh, I had a thought, but I can't remember what else I was going to say about a signer. I had a story. Anyway, um, so VRI today is, wow, it's becoming much more widely used. It's a remote interpreter compared to a live in-person interpreter. So VRI would be on the screen. So a lot of medical offices have like the Marty system, the screen that you're kind of signing to. There are positives and negatives, pros and cons for that. A live interpreter, I know you have to find somebody and it sometimes takes time. So of course there's pros and cons, as I said. So my wife is deaf, and there was a situation where she had vertigo and she became very dizzy. And so I drove her quickly to the ER, and they brought the VRI in there. But of course, she couldn't see the screen. She was looking down. And I'm like, why? How do we communicate with her? They had the screen, but the screen is not accessible. A live interpreter can get down on the level that she's able to see and can provide that communication access. So I was there and I was like trying to be a deaf interpreter. So I was interpreting for the VRI system to my wife. And it was a very interesting, again, positives and negatives. There's pros and cons to every situation, but the deaf community is really in an uproar about VRI typically. They really prefer a live in-person interpreter, but as we've already said, there's a shortage and sometimes it's hard to find interpreters that are available. Deaf interpreters, as I said, my new journey in becoming a deaf interpreter. And so if you have a deaf person, you have a hearing interpreter typically. And so you can kind of read the deaf person's expressions. Maybe they might use more rural signs, or perhaps maybe they have a foreign sign language, and communicate is heavily in gestures rather than actual signs. And so you have to kind of read between the lines. As a deaf interpreter, it's more language accessible, and they're able to analyze that language a bit better to relay it to the hearing interpreter. So that's when you might bring in a deaf interpreter. So, yes, we've seen a lot of problems coming up, not enough access, there's lack of educational services for interpreters. Kind of already mentioned that here. Let me just see. Lack of access to interpreters, as I said, which makes communication difficult. So, for example, in the emergency room, if you go into the emergency room, my biggest fear is to go into the emergency room and I'm worried about communication. What am I going to do? Because it's my health, and I'm worried about my health, but I'm also worried about communication. So a hearing person comes in and they're worried about their health. They're drawing blood and they're doing all this. And I'm like, well, do you have an interpreter? Do you have the RI? Do you have any kind of communication? So my concern is double. And I'm not just concerned about my health, but now I'm also concerned that is everything being relayed and communicated appropriately? So American Sign Language, um, people tend to say, "Oh, it's people with disabilities. That's a disability needs." But it's not. ASL has rules, as I said. There's English grammar, English has rules, and ASL has rules. It's just different. And American Sign Language is a three-dimensional language. It's very visual. You use space. They tend to be more direct. Again, we have all these cultural adaptations that we have. There's no written version of American Sign Language. English has a written version. They don't yet have a recognized American Sign Language written version. They've tried, and it hasn't necessarily been successful with that. Okay, and next slide. So what do we do? What do you guys do? Um, so again, I would encourage you to look at the ADA and see the different information that would help you improve services that might be provided in your office. Look at the REW, the Code of Washington, reviewed code, or what is it? Revised, thank you so much. Revised Code of Washington. Yes, we got it. Yeah, so if you take a look there, there's a lot of instructions, and that's better than than the ADA in some ways. So you take a look at that. So it's really important that, again, that interpreters have skills in courtrooms, there's skills in medical, there's some who are more skills educational. So one interpreter in Canada, um, he's in Vancouver. Oh, he's a very skilled medical interpreter and can explain and describe things. And I had never seen some of those signs before. And I was like, oh, okay, that's how he's showing this. And it's just so much more clear. It's very graphic, and you actually have a visual picture to help you really understand what's going on inside your body and the body systems. And it's been amazing to see different interpreters who have these different skills. So the Deaf Center, again, maybe you guys go into a medical office, like, how can I improve my services? How do I improve my communication? And discuss it. So, but they might not include you as a patient. They might just kind of be talking talking about different things. But we want to make sure they're including the patient and including everybody to see how that they can actually make these improvements. And that's what the Deaf Center really does. They want everybody to feel welcome. I don't want to have to worry about my communication as an issue. That way I can just focus on my health and my medical health. It's really important, again, that you guys are discussing your patients and your consumers, your clients, and your students, really discussing with them and knowing what their needs are and trying to understand from their perspective. So, and again, also your policies and make sure you're checking your policies, make sure that you have something to provide communication access. If there's nothing there, then it might be more ambiguous. Whereas if it's actually in your policies, it'd be easy and ready to reference. So also, it might be a great idea to have access knowing where you can find ASL interpreters so that if a deaf person comes in, it's already ready. You already have contacts with an agency who can hire an interpreter. I know that my time is running out. I'm trying to get to this quickly. So deaf friendly. The deaf community always uses the word deaf friendly, which just means that it's an open concept space. They feel welcome. We feel like, for example, if you come into a place and there's language posters, and it's kind of funny actually when you see like there's a Spanish one, a language, we provide interpreters. In Spanish, there's a sentence, we provide interpreters. And then in Russia, there's a sentence, we provide interpreters. But when it comes to ASL, it says we provide ASL interpreters, but in English. It doesn't have it in ASL. It has it in English. So some actually have made up and added some little signs at the bottom. It's actually in sign language. Again, there's no written language at this point. So a written form of sign language. So they would use some signs on the bottom of that sign. So my last closing point here is baby signs. Today, there are many hearing people who have hearing babies, and they're like, oh, great, maybe I'll teach them a little bit of sign, and this is great. And then they grow, and then they develop, and later on, they're just speaking, and they picked up spoken language. But at the very beginning, they're signing like milk and cookies, and that's great. And then it's very exciting. My daughter too, as I said, taught her sign language. It's so cute. When she was signing, and then she just became used to it as a child. A deaf baby, when you have a deaf child, they say, "Oh, don't sign with them. Don't sign with them," which is basically just like handcuffing their hands, saying, "Oh no, we want them to develop hearing. We want them to develop language. Don't sign with your children." And so it's somewhat ironic that we're teaching hearing babies sign language, but deaf babies, they're saying, no, don't teach them sign language. So it's interesting. Of course, I think the focus should be on communication. So yeah, that's just a bit of irony. My friend drew this, and it's really taken off in the deaf community. So, um, okay. So if you're curious, you want to look more into it, find some more resources. It's important. Again, I think it would be beneficial for your for your community services to have this language access. There's the Hearing Deaf Speech Center. They've been there for over 20 years. And it's still open in Seattle. So you could contact them and ask any questions that you might have about how to improve services. There is the Office of Deaf and Hard of Hearing that's under DSHS. And you can contact them as well and ask any questions that you might have. You can look up Language First. It's a very popular organization, and there's a lot of information really in depth about examined proof and facts about evidence-based information. The Washington Center for the Deaf and Hard of Hearing at Youth, that's in Vancouver, Washington, and there's a great educational school there. And then this is a sign for thank you on the slide. Does anybody have any questions? I don't know if we have time, if that's permitted right now.
Do you have a recommendation for a deaf teacher, like online classes for ASL by deaf?
Teacher. I know here there is one deaf teacher. I think Whatcom has it, and it's an online school. I think Western might also have one. That way you don't have to commute. But there's Linda Boyd is a deaf teacher, and she's a really good teacher. I'm sure there are others around, other schools. I think there's one more, but I forget their name. But family friendly. You can learn sign language. the name escapes me, Handspeak perhaps. But again, if you look online, there's lifeprint.com, and that one's really great. So if you have time, on your own time, take a look, and there's different signs that you can look at. Yeah. Is that good? All right. That's it. Thank you.